What is the climate like over there in Australia? Is it like what it is here in the US or even in England and oh gosh, okay, we're just going to say it all over the world, where you have this
Yeah.
contingency of doctors, maybe 10% of doctors that are like you that are trying to exhaust all efforts to save the limb, even if it does mean a revolving door and consistent treatments, one or two times a year versus the 90% that are still out there saying it can't be done, it shouldn't be done. The patients are better off with an amputation. So patient go walk, walk, walk. And when you're in so much pain that you can't take it anymore, come on back and we'll just take it off.
Yeah. That's a good question. I think so. We've actually been looking at our government data, and
Yep.
for sure we are seeing amputation rates are not rising in Australia, and but the number of peripheral interventions is going up. So I think we are seeing a mass adoption of endovascular treatment. And we are definitely saving more limbs in Australia. I think that's not probably universal, though. In Australia, we have this thing called a postcode lottery, and it's because the country is so big that, if you're in an area of Australia where they don't have a specialized limb salvage team, you're probably going to lose your leg. And so it's the tyranny of distance in Australia. We're not like the US where you've got big cities at very regular intervals. We've got a desert in the middle of the country, and a lot of people actually live in that area. And a lot of the people who live there are at risk of P.A.D. and losing their limb. So, in big cities like Sydney, the limb salvage rate is pretty good. We have multidisciplinary foot care teams. But then as you get further out away from the cities, that becomes a problem. And I think it's really incumbent on us to either go out there into the country areas or to develop the pathways so that patients know where to go for advanced limb salvage.
So I assume you have a standard set of protocols, for how to treat, these patients across, society guidelines or something that guides you to say, hey, you need to do X, Y, and Z prior to amputation, or is it still a little bit of the wild, wild west in some of those more desert regions?
It is. It is a bit of the wild, wild west. I mean, there are, I think frequently patients aren't even referred. Maybe they're referred to the local general surgeon or the local orthopedic surgeon who just removes the leg or attempts to remove some of the toes and then the leg goes. So, yeah, I think that's one aspect to it. We've got a lot of new younger surgeons who are coming online now. So I think we are beginning to see a shift towards more endovascular focused practice rather than this sort of debate about open surgery. So I think that's changing as well, but it's taking time. Yeah.
It's there's nothing against open surgery. I would even rather, and I even guide patients, and it's helpful for me to know if there are certain areas where, the patients know that, at the very least, hey, doctor, you should be doing a bypass. Hey, doctor, you should be doing an endarterectomy. Refer me to another doctor. If you're just saying you're going to cut off my leg, then at the very least, if you don't have a doctor there that performs endovascular options, at least we can kick the can down further and give them, another 5 to 10 years possibly before they need something else. And maybe by that point, there will be newer approaches, newer tools, newer techniques in your region or their region that are adopted, right?
Yeah, absolutely. Absolutely agree. Yep.
So they should at least be asking and saying, hey, don't just cut off my leg. Well, do you have some sort of bypass option? Is there some sort of endarterectomy that you can do if you don't do endovascular? But there is a lot of issue between public and private hospitals, just that, is there, well, we don't have public private, but we have government insurance, and then we have, of
Yeah.
course, private insurance. So a little bit, of the same. how does that work there in terms of patients if they're in the public hospital and they come to us and they say they just want to cut off my leg?
Yeah.
How do can we get them to private? How does that work to get them the referrals so that they don't get alienated or piss someone off?
Yeah. Look, so in Australia, we have universal healthcare. So as an Australian citizen, you get free healthcare. And I think we're all quite proud of our universal healthcare system here in that it is very high quality. The private system really allows you to jump the queue. In the NHS, where it's only public, there's a massive queue and you can't get ahead in any way. Whereas here in Australia, the private allows us, if you pay a little bit of, or it's quite a bit of money these days, but if you pay some money into your private healthcare fund, when you need to use it, you go to the top of the line and you get your treatment done straight away. Look, I think when in my practice at least, I'd say the majority of patients with P.A.D. are publicly insured. I don't treat them any different, whether they're public or private. For me, it's P.A.D. It's a patient, they need their leg saved. That's it, right? And I think if someone, even in a public hospital, is being told that they need their leg removed, they have the right to seek a second opinion. And they can really go anywhere in Australia. The burden really is on them at that point if they discharge themselves from that health facility. But I mean, we get patients all the time here at Prince of Wales coming to us from other hospitals where they've been told that they need their leg removed, and we do some procedures and save them.